want to bring you some breaking news. The Ontario government is reporting over 18,000 cases of COVID-19 in the province today. We'll break down those numbers for you next hour. Meanwhile, the Ontario government says it will stop reporting the number of COVID-19 cases in schools. And that's angered many in the healthcare profession who are questioning that move. Let's bring in Doris Grinspun. She's the CEO of Registered Nurses Association of Ontario and joins us more with her reaction to this decision. Let me get to this tweet that you put out last night. You tweeted that Ontario parents have entered Trumpland. Can you explain what you meant by that?
Yeah, well, what happened during the administration of President Trump, as you know, is let's not do testing because the more testing you do, the more cases we have. And then, of course, let's not report. And the moment that you don't report, and to me the most striking was the last presser of Kieran Moore, the Chief Medical Officer of Health in Ontario, which really I thought it would be different than Dr. Williams, but is proving to be a very, very concerning politician more than public health servant. The reality is, if you don't test, which already we are not testing enough, so the numbers, Hannah, that you will be reporting are not really 1,800. They're more like 5,000 likely. If you don't test, and then if you don't report in the schools, if there is an outbreak, basically, you are saying you don't diagnose and you don't count. Dr. Moore also said that people that will enter the hospitals for reasons other than COVID, say they have an appendicitis, he said, and that's kids in general, or they come from a car accident, or they come from another condition. If they then show to have COVID during the hospitalization, they also will not be counted, which means even if people die from COVID, Hannah, and they were not diagnosed or tested for COVID before they enter the hospital, they will not be counted as death. The reality is...
Let me just jump in here for a second. You're talking about Dr. Kieran Moore. He's the Chief Medical Officer of Health for Ontario. And one of the things you mentioned is that it was a political decision. He responded to that. He says, he said on Thursday, it's to limit testing to high-risk individuals was a political one. Moore pushed back, saying the province would test everyone if it had the capacity. He said they have to pivot to where there's ongoing community activity. How do you respond to that?
I respond that that's absolutely not the case, that the province has the capacity to test, certainly has the capacity. It's a choice if you want to be transparent and report, or what Dr. Moore also said is basically in the spring we will have a highly, a population that will have, we will be much better off. Basically, let's ride it. Let's ride it and see where it lands. The reality is, Hannah, that there are less than 100 beds for ICU for pediatrics in this province. And if we do not manage this pandemic, the coronavirus, the Omicron in the schools, we will end up with kids that will not have access to those pediatric beds. Every single year we have issues with pediatric beds in ICUs in the province, only with the flu, let alone with the flu and Omicron now. So let's not test, let's not say how many we have, let's not report in schools, and what happened will happen, and we will deal with the system collapse.
What do you make about the argument that there aren't enough tests to go around, and as children are generally at lower risk, there's not much point in reporting positivity rates? What about the fact that there aren't enough tests?
Well, first of all, children in the U.S., we can already see, we just choose not to speak about that, are ending in hospitals in large numbers. They're ending up in ICUs in large numbers. They transmit the virus the same as an adult. And the children that will be affected here the most, including their families, are those in low-income populations, people, same as in the first and second wave in long-term care, we will end up now in pediatrics and in the third wave. Basically, people that cannot afford to pay privately a test because people are paying $200 for a test privately, people that cannot afford the KN95 for children, which is $3 each. So some of us, both for our grandkids or kids, most people cannot afford it. So basically, we are letting down the same people that we have always let down, Hannah, those that cannot afford private services. And so the question is this also a way to start to privatize healthcare, as they have done with nursing, by the way, Hannah? They have not responded to the crisis in nursing. They have not repealed Bill 124, and nurses are moving to agency, and then hospitals pay 3 times the money. So it's a way of privatization. It's a way of letting down those that are most vulnerable, not helping them.
But so for parents, even with Omicron, they are still keen to get their kids in school. They don't want to see them lose more classroom time. When would you like to see a return to the classroom? Well,
let me tell you this. Let me start with our own kids, my grandkids. They're all going back to school. It's important. But did we get them the KN95 at $3 each? Yes. Can most parents do that? No. So nurses are not saying schools should not be open. Nurses said schools should have been open with absolutely strong public health measures outside of schools, meaning we didn't need to have all those events of 1,000 or more people gathering. We needed to say for the holidays to absolutely prevent large events, prevent large gatherings. We needed to close the malls. We needed to close the Boxing Day, large boxing stores, right? Not the small places. Those are not the places where things are happening, Hannah. And we didn't do any of this. So to me, basically, to nurses, the government once again chose the business priorities of the well-to-do business, quite frankly, not even the small-to-do business, in lieu of protecting children, which not only will end up in ICUs, and you will see that, and it will be a tragedy, also will bring back the virus to the same populations that it happened before, that they need to go to work because they are on minimum wage, that they live in crowded quarters because they cannot afford big houses, the same old same. And that's what nurses so oppose, and that's what most doctors so oppose. 500 signed, yes, open, but the rest, which is 30,000, and no nurse has signed that, basically are saying kids need to go back to school in safe conditions, and that is not the case. And that's what's tragic here about Dr. Kieran Moore, and also celebrating that the Minister of Education, Stephen Lachy, did everything he can. No, they didn't do everything they can. The only one that's done everything more is actually Minister Phillips in long-term care, with the 4th booster to seniors, with the 3rd booster to mandatory to staff. That is action that follows policy, not politics.
Doris Grinspun, I'm afraid I have to end it there. I'm sure we could chat all day. I want to thank you for your time. Ms. Grinspun is the CEO of Registered Nurses Association of Ontario. Thank you for your time.
Thank you.